talking about money today. So we're gonna do 26 and 25.
I heard that can be the root of evil.
So if you're a supervisor or manager of a department, a lot of responsibility is going to be on you to maintain your budgets within your department, make sure that there isn't any wasteful use going on or wasteful spending. So a lot of that responsibility is going to be on you as the leader of your area. Another responsibility that you'll have is that you'll work with a couple of other individuals to help build your budget every year. Each year, each department within an organization has a budget. And it doesn't just magically appear. It's something that usually the supervisor or the manager will develop. And like I said, in most cases, you'll have some assistance from other people, usually people maybe in the finance department. But you will definitely absolutely be involved in the budgeting process. And we'll talk more about what exactly goes into that. Here are three functions of budgets. You have planning, controlling, and evaluating. The planning portion is basically creating a plan for your budget or a financial plan for your budget. So usually this is something that involves looking into the future. This is what the planning portion of it is. The controlling portion is basically the operation or the management or the administration of the budget, actually running the budget, making sure that everything is carried out. And then evaluating comes more so at the end. So if our new budget starts next month and this month ends our budget, we will go back and look at the budget to see how close we were with our forecasting. Were we over? Were we under? Were we right on target? And you want to evaluate so that when you make your next budget, you can make those adjustments based on what you find from your evaluation. So here are a few rules of budgeting. The first one is expenses are always charged to the department that basically creates them. So even if you're in the cardiology department, but there's another department, we'll say pulmonology or something, that creates an expense for your department, you still want to bill it to that appropriate department. Does that make sense? Basically, whoever creates that expense needs to be the person that is billed for it. And then the second point is that every item of expense must be under the control of someone. So there shouldn't just be expenses on your report that aren't attributed to anybody. If there's a line item expense on the budget, it should be directed to somebody. Somebody should be responsible for that expense. So if we had extra toilet paper one month, it has to be attributed to somebody, whether it be janitorial department or whatever department that may be. But every line item has to be pointing to somebody or some department. As I said, it's a must that you participate in the budget process. There's not any argument about that. That's pretty much a hard set rule. There's no way getting out of that, as much as you may hate to budget. And supervisors must not be held responsible for expenditures that you don't have control over. So let's say a pipe burst in your department. Obviously it has to be fixed, but it may not necessarily be something that you are responsible for. So just keep that in mind. Things like that will come up. This is an important one. If you have funds in your budget that are not used, generally they aren't carried over. So if you don't exactly do your forecasting right and you have extra left over, you need to find some type of way to spend it, to get rid of it. Otherwise, you will lose it. So I've seen instances where, departments done a really good job at saving money. They budgeted really well and they had some left over. So they went and they would survey the staff to see what is it that we might need that we don't have, so they can try to use these funds so that they don't lose them. Because usually what happens is you lose it or it goes somewhere else where there's a deficit. So you want to make sure that you use everything that you have if you have some left over. As I just said, whatever's left over may not be transferred to a different category. So if you have capital expenditures, does everybody know what capital expenditures are? These are funds that deal more with capital, meaning larger projects, expansion, renovation, etc. So those types of funds can't be transferred to operating expenses, which are expenses that you use for your daily operations, two completely different categories. And they're completely separate, so we can't transfer funds between the two. You may have some needs that will require approval. Sure, you're the leader of your department, you're managing your department, but there's some things that you will have to go up to your boss or maybe even your boss's boss to get approval before you can spend that money. So just don't think that just because you're in charge, you can sign off on everything that you want to buy. Can you think of any purchases that may require additional approval?
Like maybe an X-ray machine.
Yeah. What were you gonna say? Yeah. So that's a good one. X-ray machine. You know, basically things that are gonna cost a good deal of money, we're gonna need approval for. Now, if we're working in the imaging department and we need money to purchase additional gowns for our patients, sure, you can sign off on that. But if we're trying to buy an X-ray machine, we can't just sign off on that. That's something that we will have to take probably a few steps higher than where we are to get approval. And that will definitely require a thorough process before we just go out and buy one. So good suggestion. Revenue. Does everybody know what revenue is? Hopefully. This is the money you bring in, right? The money you make. Very good. I know. How many people have had accounting yet? So there's a couple. Okay. So depending on what organization you work for, your revenue will come from different places. Some organizations will have mostly just patient revenues based on patient services. Other organizations will have other ways that they make money, and they'll get revenue from that way. So your revenue really will depend on what type of organization you work in and how you guys make money. So the process. Budget process is very intense. It usually takes a couple months and months to prepare. So it's not just something that you can do in like a week or a couple of weeks. It's something that most managers will start far out in advance because it's a process and there's a lot of work that goes into it. And even once you finish your budget and you submit it, they'll probably send it back to you with some corrections. So it's a little bit of back and forth until everybody's okay with the budget that you created. And because of that, you want to make sure that you have plenty of time to do this, at least a few months. And as I said, you'll have people from usually the finance department that will help you as a manager to develop your budget. It's not just something you have to do completely on your own, but it is something you do have to be involved in. We just talked about capital expenditures a little bit. We'll go into it a little bit more. For capital expenditures, the capital equipment is usually a separate line item on your budget document. And it's usually something that's forecasted or projected out for a few years. As it says here, 2, 3, 4, or 5 years. Why? Because these things cost a lot of money. So again, these type of purchases aren't decisions you can just make like this. If you're planning to buy a new X-ray machine or you're planning to build out your emergency department or renovate something, these are things that have to be planned out for years before they can actually take place. Another line item on your budget is going to be your salaries, so your wages, your benefits, and your overhead. It's important to understand that salaries is just more than just the actual pay that they make, but benefits is also a big portion of your salaries because you're paying health insurance premiums every month, as well as any other benefits that you're providing to your staff. And then overhead as well. Does everybody know what overhead is? No?
The
Yes?
light bill.
Overhead. What'd you
Like
say?
the glue.
Somebody said it.
What's in the light bill, the
Yeah.
building that you
Yeah,
rent?
right. So the light bill, the facilities, the
Yeah.
building, utilities, all those things. The things that will allow you to run your business is basically your overhead. So once you get your budget report, you want to look at it as soon as possible. That way you have time to make, see if there's any errors and correct it. Usually you'll get a few rough drafts. And like I said before, there's a lot of back and forth. So as you get those drafts, you review them, you say, oh no, we spent this much last year, it should be this, et cetera, and then you send it back and it kind of goes back and forth. And like I said, this is kind of a group collaboration kind of thing. So if you're the manager, you may also pull in your supervisor, as well as maybe a charge nurse or somebody else to assist you with the budget process. So another big factor that can sometimes show up on your budget is overtime, which is very, very critical because as we know, with most overtime situations, you're paying not just regular salary, but you're paying time and a half. So here are some causes of overtime. Variations in workload, meaning workload that changes often. If employees are continuing to be out for work, whether it be them being sick or whatever reason, regardless, you have to hire somebody else or bring somebody else in, or other employees have to work more time. If someone's not performing up to the level that they need to, and unfortunately, in some places, they've come to accept overtime just as something that happens, which is terrible because, again, it can completely mess up your budget, but it does happen in some organizations where they just, instead of looking for alternative ways to deal with the more work, they just automatically let people work overtime. What about us? Maybe we're not doing what we're supposed to be doing as a manager or as a supervisor. Maybe we're not up to par on our accountability. Could be a cause of overtime. Scheduling practices may not be where they need to be. Maybe we've said that if you do this, I'll let you work overtime. Another terrible practice, but it happens. And just not being productive. If people aren't utilizing their time wisely or utilizing the machines or equipment, it may cause them to work more time than they need to be. How do we control overtime? Before we even get up here, what would you guys do? If overtime is a problem in your department, what do? You gotta cut it.
Yeah, because also it cuts in on your budget as well.
Yeah.
Reevaluate.
Reevaluate employees. Okay.
The workload.
Yeah.
Workload. Reevaluate workload.
Well, I mean, like,
Are they completing the work?
yeah, yeah.
Okay.
With different strategies if one department is not meeting up to standards or,
What type of strategies?
maybe like employee and like business value and the way they treat.
So you're thinking maybe it may be a morale issue.
Yeah, like morale.
Okay. All
Or give
right.
them certain deadlines they have to meet this, so we can stay on target.
So set deadlines.
Set, something in place that you
Okay.
have to meet in order for us to be on target, so we won't have to utilize the overtime.
All right. All right, so I think those are all good suggestions. And I'm going to reiterate this again because this is a big problem, especially in hospitals and healthcare organizations. As you said, overtime can completely eat up your budget. And if you're spending so much time or so much of your budget on overtime, it's going to reduce your money to do other things you need to do in your department. So here are some of the ways that the book suggests that you kind of control your overtime. You want to regulate the demand. Analyze and improve staffing practices. I think you guys said that. Analyze and improve work methods. Somebody said that. We want to control absenteeism. So if we have somebody that is continuing to be out, we need to quickly evaluate that and don't let it to continue to happen. They may need to be fired, right? Because every time they're out, they're hurting our budget. And manage responsibly. Again, some of this is on us. If maybe we aren't managing appropriately or managing as well as we need to be, and as a result, we're having overtime. So while we're looking at our staff and looking at their work practices, we probably also need to look at ourselves to make sure that we've done everything we can to try to control the overtime. Cost control. So controlling overtime is one example of cost control, but it shouldn't be your only method. And cost control doesn't just relate to cutting overtime or cutting staff or cutting hours. It also relates to looking at your inventory, looking at other ways that you might be doing wasteful things or not making the best use of your time. All those things relate to cost control. And again, as manager or supervisor, that falls under you also. So let's go back to our example with the overtime. And we're thinking that, in addition to having some employees that have been absent frequently, we have some other employees that aren't performing well, and they're affecting our budget, so we need to lay some people off, right? Now, before we consider laying people off, here are a few things that we should look at. If we have any temporary staff, we should get rid of them. Why do you think that's the case? Have any of you worked as a temp staff? Okay. What can you tell me about the pay?
Don't the company pay them and also
The company.
company too, the temporary staffing company? The staffing company pays the employee, but the company that hires the.
It's a higher
staffing
rate,
company.
so they can
Yeah.
pay the employees a certain amount.
Yes. Most temp staff are paid at a higher rate
Mhm.
than what the normal rate is. So if both of these students are CNAs and he was hired by Cape Fear and she was hired by temp staff,
Mhm.
more than likely he's making $10 and she's making $12.
Mhm.
So eliminating our temporary staff is gonna cut down our cost a little bit because like I just said, they're gonna, in most cases, be paid more than your regular employees. Does everybody understand why that's the case? Because that person is in demand, they need them, so they pay more. We wanna close down any unfilled positions. Why do we wanna do that?
If they're sitting out there, you gotta look at, do we really need those positions?
Right.
Or are they just extra positions? So
Right.
if we really don't need those positions, there's no need to hire them because that's more money in the budget. as
Well, it's counterproductive if we're looking at hiring people and then we're considering laying off.
Yeah.
We're gonna be, still even, so maybe before we look at hiring some other people, maybe these people can fill some of these responsibilities that we're looking for this open position. We need to look at some full-timers who will go part-time, right?
That's rare, isn't it?
Yeah.
Well, it depends.
Really?
If someone is planning to have a kid or
Okay.
maybe looking towards retirement or maybe they just
Okay.
got married and their spouse, says, honey, you can go part-time,
Mhm.
whatever. There's different scenarios. It
Okay.
happens
Sure.
Okay.
sometimes. Consider part-timers who will reduce hours. Again, this one's kind of, it could happen.
Mhm.
The point here is that these are all things that we have to consider. It may
Right.
not all work, but we have to at least think about them and consider them. Ask for voluntary separations and ask for retirements. These last two, I would probably make my last resort. I would exhaust the rest of these first before I move to these. Because it's kind of odd just walking up to somebody and saying, you thought about retiring yet? You know what I mean? So,
And then as far as the voluntary separation, they may ask for like a severance or something.
Yeah.
So that's more money.
right. Another form of controlling costs or cutting costs is process reengineering. This is a method that really focuses on trying to be more efficient. Well, how can we do more with the same resources that we have now? Or maybe even how can we do more with less? So it really focuses on being efficient. And I have seen this work for a lot of different hospitals. It just takes a matter of a little bit of thinking about it. Some people will bring in consultants to help them with this, but this is a process that has been proven to work and save a lot of money. Benchmarking. So when we're looking at controlling costs and cutting costs, maybe we need to look at what other people are doing. How do we find this out? Well, we read articles, we read journals, we pick up the phone and call the hospital down the street and say, what are you guys doing to save on your supplies? So there's different ways that you can benchmark to assist you with cutting your costs and seeing where you are with your peers. So the process of benchmarking, as I just said, there's different ways you can collect data. You can read through literature or site visits. Regardless of the way that you collect the data, after you collect it, then you'll analyze it and then put in an action plan. So let's say that this hospital has been able to save $10,000 in costs, staffing costs. Your hospital has lost $10,000. So you may want to set up a meeting to talk with him and see exactly how they went about saving that money, and then he'll give you information, whatever information he gives you. You compare your own organization and how you do things up against how he does things, and that's how you get the data, and then you analyze it. And then once you've analyzed it, the last thing is the plan. So you would say, by this date, we're going to do X, Y, Z. By this date, we're going to do X, Y, Z, and that's how we're going to save $10,000 next year like they did. So benchmarking is basically comparing yourself up against someone else or another organization to see where you fall out at. Any questions about 26? Cost control is very important, especially as a manager. It's going to be your responsibility to save as much money as you can. And if you are able to save money, you look like a rock star. If you aren't able to save money, you probably look like the opposite of a rock star. Chapter 25 talks about managed care. It's going to be probably more of a review for you guys than anything. Everybody knows what managed care is, right? Hopefully, yes. HMOs, health maintenance organizations, are basically the principal form of managed care organizations. It's something that started in the 70s. And the focus of managed care is basically cost control. How can we provide services but still have reduced costs? And at the same time not affect our patient care or our patient quality. Here are some of the features. Some of the arrangements are a little bit complex. Even if you think about your own plan and you read over the details of your own health plan, you probably get a little confused because it is very complex. I mean, I get confused when I read mine. They sometimes provide incentives for you as a customer and for physicians as the providers. And usually the access to your providers is very defined. For example, if you have Blue Cross, you can only go to XYZ physicians. If you go to this other physician, you may have to pay blank. So the rules to access are very defined. They usually have controls on how you can use your services. For example, there's probably some services you can only do once a year, like your wellness visit or whatever. You can only have one a year. That's an example. And then there's just coordination and integration of services. If you go, for some plans, if you go to your primary doctor, then they will then refer you to someone else. That's a part of coordination of services. And most managed care plans, again, are going to be focused on quality of care. They want to make sure that the patients are getting the care they need at a high quality level. One feature of managed care is capitation reimbursement. Have any of you guys heard of that? It's somewhat of an old concept that is not used as much anymore. But basically, this process, it transfers financial risk from the insurer to the provider. Like I said, it's not something that is as popular as it used to be earlier back in the years. Gatekeeper. We kind of just talked about that. Usually, in most cases, your primary care doctor is your gatekeeper. Again, you have to go to that doctor before you can see other doctors. In some plans, not all plans. Plans are changing now so that you can skip the gatekeeper, but there are still some plans that do have the gatekeeper physician. So what are some other managed care plans? We have IPAs, independent practice associations. PPOs is one that's becoming a lot more popular now. I have a PPO. Point of service plans, physician hospital organizations, and physician management companies. These are all different types of managed care plans. So what's the challenge? We're losing money, reimbursements are going down. How are we going to make sure that our patients are still okay? It's a big challenge. So a big challenge is to maintain high quality, even though our costs are getting cut, our reimbursements are going down, we are responsible, ethically responsible, to still be able to provide high quality to our patients. That's the big managed care challenge. Here are some other challenges. Obviously, with the internet, everybody's on the internet now, so patients are becoming less trusting of providers than patients of earlier generation. I personally attribute this to the internet. What do you guys think?
Can you repeat that?
It says that patients now have less trust. My point is that I personally attribute that to the internet.
Because they go and search what their doctors have stated they have or whatever. They
Right.
check it out themselves and see.
Do that, or it may be a scam.
Or scam.
I said I've done that too, diagnosed myself before I went to
Yeah.
the doctor.
Web and D will lie to you.
That
will lie
plus,
to you.
Really?
now there's just more information in general. We can see scores,
Right, you can see what they got.
quality levels,
Right.
and that's good. And if for whatever reason a physician is not at a score that you expect them to be at, it may cause less trust, right?
Mhm.
How
So
about
just
the news when the guy here in Fayetteville ran a clinic?
Oh, yeah.
Who, so who
Was
was
he
trust him in
licensed or
Fayetteville, like,
something?
Yeah.
like who was doing the checks and balances?
Right.
So that makes it very, very hard for people to wanna, get care.
Yeah,
Because
so
it might
even, I
be
guess you could say sometimes the media too
Yeah.
doesn't help with the trust either. But anyway, the take home here is that in general, patients have less trust now for providers than patients of earlier generations. Providers are more stressed now. They're busier, patients are sicker, and they're getting less money. So they're definitely stressed. Understaffing is becoming a problem. Why? Because we don't have the money to pay to hire people to bring them in. And work units, departments, as all these things are changing, these departments, these staff members are being forced to constantly change, which, if you think about it, is probably pretty stressful for the staff. All right, so we just talked about process re-engineering. Well, some places, when you go in and you say, we're gonna do some process engineering, people automatically start worrying about the jobs because they think it may result in cuts. And in some cases it does. Nonetheless, people start having reduced job security. When people are stressed, then they might make more mistakes. So errors and mistakes might play into it as well. Some might see that as a problem. Again, we just talked about losing money and space and how that might affect our services. And changes in laws happening every day. Another reason for people to be stressed, another challenge. So, what do we do as providers? How do we avoid this? How do we get through these challenges? Well, there's a few different strategies that we have to take. One is clinical pathways. Now, this is more of a clinical concept, so you guys may not know much about it. But basically, clinical pathways are like plans almost. You can say they're planning or forecasting how outcomes should happen for patients. And what these do is they allow the care to become more standardized. If you have these plans set up in place, and regardless of what shift the nurse is working, they know what's expected, what's supposed to happen, what type of outcome they should get for the patients. Patient-focused care model. Well, the name pretty much says what it is. This type of care is when we focus on the patients. Again, we are trying to create departments and units within our organizations that are somewhat self-sufficient, but also allows for every patient to receive the type of care that they need to. And if this works successfully, it can be done with less staff. Benchmarking, we just talked about. Benchmarking can be done in several different ways: clinical, operational, financial. Basically, any category that you have at your organization can be benchmarked. About education. You know, if things are changing as rapidly as we say they are, we definitely need to make sure that our staff is constantly updated, constantly educated on things that are going on. Now, it doesn't necessarily just have to be continuing education type of meetings, but we could also educate them in budgets, how to do budgets, talk to them about staffing. Maybe we have a lunch and learn so that they completely understand how the staffing affects our budget and why we have to reduce hours and why we have to cut overtime. Those are all ways of educating our staff also. All right, survival competencies. So here are a few. First, we have clinical management. This deals with the actual provision of services. So we're monitoring how productive we are, how long each nurse is taking with each patient, how well are we doing at utilizing our supplies, are they using way too many bandages, are they not using enough bandages, how are we using our sharps, etc. And disease management, which basically means we're managing how our patients are doing. Financial management deals more with budgeting, cutting costs, looking at costs, analyzing costs, looking at statistics, those types of things. All right, now information management basically deals with just what it says. So we're looking at our communication, we're looking at our charts, our medical records, and we're looking at how we can improve our quality. And then leadership, very important, that's us. So we're looking at our personnel management, how well are we doing at communicating? Are we doing everything we need to do to build our teams, build our department, and how well are we managing our time? What can we be doing to make better use of our time? Employment flexibility. Basically what this means is as you guys finish your program and you get ready to go out into the workforce, the more flexible you can be, the better. The more diverse you can be, the better. So what this means is that employers will be looking for candidates like yourselves that can be flexible and maybe can work in more than just one area, because then you're going to be more valuable to the organization as opposed to just working in one specific area. Also, if you're able to move around and be flexible and work in different areas, you might also be doing what? Saving costs, right? Because if you can help them in more than one area, that may prevent them from having to hire somebody else. So you may say, you know, cost cutting, all this stuff sounds pretty interesting. I think I might want to work in managed care instead of working in a hospital or something. These are some of the areas that you could go into. So case managers, utilization reviewers, advice nurses, authorizing authorities, marketing and sales, maybe you want to sell insurance, claims and benefits administration, and actuarial service personnel. And these are just a few. These aren't all the areas in managed care, but these are a few. I spent a little bit of time working in managed care, and I worked mostly with trying to go out and get physicians to join our network. So it was a physician that wasn't in our network, but you know, maybe our customers kept calling in and saying, is, you know, Dr. Jones in our network? And we kept having to say no. Maybe we would go out, talk to Dr. Jones and see what we could do about having them join our network. So that's where I did most of my time in managed care. But there's, you know, tons of different opportunities within managed care. So if you decide it's something you may want to look into, sky's the limit. We'll stop there for today. And you guys don't have any questions, then I'll see you on Thursday.